Dr. Mrinal is the obstetrician. Okay, so he's called me in. I don't know what for, but he's called me into the labor room. Yes, doctor.
It's a singleton, delivery and around 3 kilo baby. Mother has Eclampsia, term. Mother has Eclampsia, so we have taken the emergency CS.
So you're taking up for cesarean. Okay. Eclampsia, she's had seizures. Any other risk factors?
Meconium was there.
And the graph was that. And so we will see, so most likely we may have to resuscitate the baby, but if we can, we will do delayed cord clamping. We will try and keep for 60 seconds before we clamp the cord, but we may not. Baby might be sick. I will get my team ready. Are you going to theatre right away? Yes. And general anesthesia, I guess. Yes. Okay. I will get my team ready. Ma'am, we have a sick baby possibly coming out. I'm going to take Manjusha and Bini with me, but if we need you, we will call you from theatre. I will be ready, yes. Thank you so much. So we have a tiny 38 weeks mother with eclampsia and meconium stained amniotic fluid with a bad graph, and they are rushing into theatre taking under general anesthesia. So we need to get ready for everything, I think. Will you take will you get the baby and the baby comes if necessary? We'll start with routine care, but if baby needs initial steps, then we will cut the cord. I've spoken about the delayed cord clamping also if the baby is all right. So we will take the baby for initial steps, and after that positive pressure medications, intubation you can do.
Since the baby is meconium, shall I put the tube initially and then do the suction?
Oh no. So now we don't do intratracheal suctioning anymore. We will do as per plan. We will do the initial steps and then we will do the PPV. During PPV, we might anticipate some trouble if there is meconium in the airway, in which case we might have to do suctioning at that point, or sometimes after intubating also there might be meconium inside and we may have to change the tube or do a suctioning at that point, but not intratracheal suctioning to begin with. So Bini, if you can help her with documentation, timekeeping, and helping her with heart rate monitoring, connecting the pulse oximeter. And I've told Radhika ma'am also, so if necessary we will call her inside. But after that, once we are underway with PPV and chest compressions, if we need to give drugs, if we can get the drugs ready also, I would say let us keep everything ready so that we are ready for everything.
No, but for the imagine that we have done with
Yes.
switching off the fan, switching on the radiant warmer to 100%.
We will wait.
Suction
Suction will
is
be coming
going.
out soon.
I've done my hand washing. So I've completed the equipment check.
So we've got the equipments ready. We don't want to keep you from lunch. Laryngoscope checks, also just check the function. You can be ready and if I come out again moment.
the pressure and the bag is self-inflating.
Baby is getting delivered. Time is 1:20.
So I'm putting the baby on the mother's abdomen.
Okay, this is a mother's abdomen.
I'm placing the baby on the mother's abdomen with the head turned to one side and drying
So
the
the
baby.
baby is not breathing.
The baby is not breathing.
Yeah.
Sir, can you please cut the cord since the baby is not breathing? And Amma, ഞാൻ മോൻ കരയുന്നില്ല, അവനെ കൊണ്ടുപോവാണ്, തിരിച്ചു കൊണ്ടുവരാം കേട്ടോ. So I'm taking the baby to the radiant warmer, placing the baby under the radiant warmer, removing the wet linen, drying the baby,
And you switched on the timer.
stimulating the baby, positioning the airway, and are there visible secretions?
No.
No visible secretion.
Maybe some meconium.
Yeah, so I am doing suction of the mouth first, 5 centimeters, and then the nose, and then repositioning the baby. Is the baby breathing?
The baby is not breathing. Can you check the heart rate, please? 40. So we'll have to start positive pressure ventilation.
I'm starting.
Maybe you can put on the pulse oximeter as well.
Starting the baby on positive pressure ventilation with in room air. 2, 3, breath 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 2, 3. 15
You can
seconds.
continue to auscultate. I don't think the pulse oximeter is reading.
Is there chest rise, madam?
No chest rise, and there's a heart rate increasing. No, it's not.
So I'm doing the ventilation correction steps.
Yes, please.
I'm readjusting the mask and repositioning the airway, giving 5 breaths. Is there a chest
No
rise?
chest rise. And you hadn't given a suction also, so maybe there are some secretions obstructing.
Dr. Bini, can you please give me the suction catheter?
I've set the whole section to 80 millimeters of mercury.
So I have sucked, I have opened the airway. I'm again giving 5 breaths. Breath 2, 3, breath 2, 3, breath 2, 3, breath 2, 3, breath 2, 3. Madam, is there chest rise?
No chest rise. No chest rise. We might have to wait, Dr. Kunal.
So I'll be increasing the pressure now. Okay, breath 2, 3, breath 2, 3, breath 2, 3, breath 2, 3.
Still
Is
no
there
chest rise.
Dr. Bini, can you please
Get
arrange
ready for
intubation?
intubation. You can continue the PPV.
Breath 2, 3, breath 2, 3, breath 2, 3, breath 2, 3, breath 2, 3. 2, 3, breath 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 2.
No heart
Breath
rate,
two,
no
three,
saturation,
breath
nothing.
two,
It's not
breath
picking
two,
up.
three, breath
Chest
two,
is not
three,
moving.
breath
Yes,
two, three.
we are ready
Breath
for
two.
intubation. Hello, ma'am. I think we need you also. This baby is sick.
What happened?
Baby is sick, ma'am. We are
Yeah,
just
I'm coming. I'm
intubating
just on
now.
the way. I'm coming. I have increased the oxygen concentration to 100%.
Connect the oxygen, please.
Do you need another suction, doctor?
No, I'm okay. Can you please connect the back? Madam, can you help me fix the tube? Yes. Is there a chest rise now?
And please, good.
Have you checked the distance?
No, madam.
If you can give me
So it's 9 centimeters.
It's 10.
Fixed it.
There is just a minute. There's still no chest rise. You could hear errantly. There's no chest rise. Why don't we give a direct suction, remove the tube, because there's a lot of meconium in the trachea.
Shall I remove the tube?
One second. We can give a direct suction and remove. Yeah. Oh yes, it's full of meconium. You can continue PPV.
Breath 2, 3, breath 2, 3, breath 2, 3, breath 2, 3, breath 2, breath 2, 3, breath 2. Is there a chest rise now, madam?
We will
Breath
intubate.
2, 3, breath 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 2, 2, 3,
Heart rate
breath
is still
2,
not
Still not increasing.
breath 2.
I think we should
three.
bring
I think we can reintubate.
Radhika, madam, can you help me reintubate? 3, breath 2.
1.5 size tube is ready. Oxygen 100% is
Yeah, it's all.
Is it 10 centimeters?
Yes, ma'am. Fixed it.
So chest was rising.
Chest is rising.
What is the heart rate now?
Heart rate is 30.
I can take
30
over
seconds
the...
up.
Yes, yes.
30 seconds are up. I think we'll have to start chest compressions.
Can you move it please? Bring the two some technique and insert it. 1 and 2 and 3 and
Breath.
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 1 and 2
I will
and
take
3
care of the
and
time.
1 and 2 and 3 and
Breath.
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 1 minute over. 1 and 2 and 3 and
Heart rate is still 40.
1 and 2 and 3 and
What's
the
approximate weight of the baby? 3 kilos.
1 and 2
I think
and
we
3
can
and
get points.
1 and 2 and 3 and
Adrenaline
One
study.
and
We
two
can
and
give
three
off a
and
3 ml
1
now.
and 2 and 3 and 1 and 2 and 3 and
Yes.
1 and 2 and 3 and 1 and 2 and 3 and 1 and 2 and 3 and I think she's getting that.
1 in 10,000 adrenaline.
I'm assuming chest compression. 1 and 2 and 3 and 1 and 2 and 3 and
Yeah, you can change.
1 and 2 and 3 and 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 1 and 2 and 3 and
Heart rate. No. We can give it
1
right
and
away.
2 and 3
We
and
don't have to. We can ignore
1
the
and 2 and 3
intratracheal
and
dose.
1 and 2 and 3 and
So
1 and
as
2 and 3
she's
and
getting this
1
ready,
and 2
let's
and
have a
3
quick
and
look at cardio also.
2 and 3 and
I think chest rise is there, airway is secured, rate and depth of chest compression seems to be alright. We are on 100% FiO2.
1 and
So
2
we will
and
get
3
ready with the
and
drugs.
1 and 2 and 3 and 1 and 2 and 3 and 1 and 2 and 3 and
I'm preparing 3 ml normal saline
1
flush
and 2 and
0.6
3
ml
and
of adrenaline.
Yes, 0.6
1 and
ml
2
of
and 3 and
1 in 10,000
1 and 2 and 3 and
Yes,
1 and 2 and 3 and
Followed by
1 and
3
2
ml
and
of
3 and
normal saline
1 and 2 and 3 and
You can close it.
1 and 2 and 3 and
Breathe in.
1 and
keep
2
the
and
next
3
dose
and
ready.
1
Necessary.
and 2 and 3 and
Breathe in.
1 and 2 and 3
Oh
and
yes,
Breathe in.
the
1
pulse
and 2
oximeter is
and 3
picking up.
and
Breathe in.
1 and 2 and 3 and
Breathe in.
1 and 2 and
It
3
is
and
70. The heart rate is 70.
I'm
You
stop-
can
shall I
stop the
stop
chest
first?
compressions. We'll continue the positive pressure ventilation.
Breathe 2 3 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 breathe 2 3
Okay,
breathe 2
so
3
it's rising. The heart rate is 100 now.
2 3
Baby is starting to show some breathing movements.
2 3 breathe 2 3
Shall we shift to the next one?
Yes, we can shift with the tube.
Can you
This
inform
baby
the
will
family?
need post-resuscitation care. You can talk to the
I'll talk to
family
them.
as well.
Breathe 2 3
That's it.